Now we will talk about the remodeling phase. Remodeling phase, it lasts for the months after the wound is clinically healed. It is characterized by maturation of type 3 collagen. It is converted into collagen type 1. It process continues until there is ratio of 1:4. Scar, it becomes less vascular, and so its color is changed now. There is wound contraction due to activity of the fibroblasts and maturation of the collagen, and the cross linkage occurs to give the strength to the scar. Maximum strength occurs at 12th week of the healing, and it never comes to the original it maximal strength, which occurs it's 80%.